Hello and welcome back to Zimboys. So in today's video, we're going to be talking about the America Zimbabwe healthcare deal. So here's what happened. The US promised Zimbabwe about 300 something million dollars to help with healthcare funding, healthcare related things, mostly to do with HIV and AIDS. So a bit of a history. HIV started in the 80s, became really, really problematic, especially in Africa in the 90s. But by the late 90s and early 2000s, medication had been discovered or invented to treat the condition, not to cure, but to treat the condition. So these medications were stupid expensive, really, really, really expensive. So only the rich could get it. I hear stories of people having to sell their houses, cars, you know, just to buy the medication. So it was quite expensive. And even though in the Western world, in Europe, in America, people with HIV were living normal, healthy, full lives, people in Africa were still dying of HIV because it costs so much money to buy the medication to treat this condition. So what happened is there's something called PEPFAR, which basically is a fund by the US president that is used to buy medication, to donate medication to African and third world countries. So there's PEPFAR, there's Global Fund. Global Fund includes some American donors and some European donors and also a bit of Japanese donors. So Global Fund, it's, as the name implies, a global effort, but it's mostly Western countries, Norway, the UK, America, and Japan in there. So Africans, because of these donations of money, were able to also get this life-saving HIV treatment. Because on our own, we couldn't buy those types of medication. We couldn't afford it. Simply couldn't afford it. So here's what happens in Africa. In Africa, we have this thing called corruption. So our governments, when they get these donor funds, they use some of the funds for the correct purpose, but some of the funds they overinflate tenders, they steal some of the money basically. So if you want to buy something in Africa that costs $50, you have to send $150 if you are donating it through the government, so that when it gets to the African country, the government, the president, his ministers, everyone can get a piece of the pie. That's how they sustain their governments, that's how they get themselves paid. So if you want to do something in Africa, you have to give a bit more to account for losses that come through corruption. One thing you can do to remedy this is, if you are donating medication, you can send medicine as medicine. So what you just ask is, how many uh, people do you have who need this type of medication? Or you have 1 million people, so you need this amount of medication, and you send that amount of medication um, half yearly or so, and you give a few more to account for new infections and to account for any additions that may be needed. That's one way to do it. However, there is need to give the government or the African Healthcare Authority of whatever country you are donating to, there's need to give them hard cash, because some things cannot be done, that way, like just sending those things, because you need fuel for the vehicles that will transport the medications from the capital city depot to small towns and small villages. You need fuel for generators, because in Africa we don't have reliable electricity. You need fuel for generators so that you can run laboratories where people get HIV tests, CD4 count tests, TB tests. There are many opportunistic infections that come with HIV. So you need sophisticated labs to run tests to identify and treat opportunistic infections. So you need money to run the labs, from electricity, lab equipment, chemicals that are used, payment to pay the lab technicians themselves. Also, you need money to do educational programs, because with HIV, it's as much a treatment as much it is an awareness thing. You need to make people aware of the condition, how to prevent themselves from getting the condition, what to do when they get the condition. You need to allocate so much money into education programs. So you can't run away from sending hard, cold cash to the governments. But then the thing is, they'll still be corrupt with it. So, to recap, the US and the global world at large has been subsidizing, if not bankrolling, African HIV treatment programs. And because we now have a new president in the White House, Donald J. Trump, he is not someone whom I personally admire. I have so many complaints regarding how he handles himself. But as someone who's not an American, not want to talk, but also because what America does affects the whole world. I think I can have an opinion about him and be justified in doing so. But basically, Trump wants accountability. He just doesn't want to throw money at African governments without accountability. So what has he proposed? He has proposed to send 300 something $1 million over a set amount of time, and he's also asked the Zimbabwean government to be a stakeholder. He hasn't put a dollar figure like we give 320 million, you give 50 million. He hasn't asked for a dollar figure, but he has put conditions. These conditions are mainly about oversight. And how do you have that oversight? You have audits. You have audits from the internal Zimbabwean or African country that is running the program, and you have also audits from external auditors. And you also need to do a thorough, stringent data collection. So the data you can collect is how many people are infected, how many people are on medication, how long are these people who are on medication surviving on the medication. You need to have percentages like 90% of people who started ARV HIV medication treatment in 2010 are still healthy and alive in 2025. It helps you to know how well is this medication working. Also, you need to know any side effects, anything. You need to have blood tests, blood results tabulated. How are their white cells looking? How is the viral load looking in the blood? So you can collect so much data, even data regarding opportunistic infections. What opportunistic infections are prevalent? What rate? Which areas? What factors? Where are these coming from? You can get so much data from the HIV treatment program. So the US is asking for Zimbabwe to give them over that data. And now this is the excuse that our president or our Zimbabwean government is giving. They're saying the Americans want our health data, but they don't want to share it with us. They just want to keep it for themselves. To which I have a question. Africans had their own data from the 80s when HIV became a thing until the early 2000s. They had their data, they had their integrity, sovereignty, they were running their things best as they knew how to. People were dying. No one was getting treated. No African scientist was in the lab cooking up a treatment for HIV. The treatment came from America and it was handed to us on a silver platter. They collected their own data amongst themselves in America and used that data to treat and help Africans. From the early 2000s up to now, Africans have been sharing their data with the Americans, and this only served to help the Africans. This is how they found out that people with tuberculosis need a bit of a different type of HIV medication treatment. They need more monitoring regarding CD4 viral load counts. They need this, they need that. You need to be extra vigilant in people with HIV to look out for tuberculosis and fungal infections, things like that. So the data we send to America only helps to benefit us because they research those things and give us treatments, information, ways to prevent ourselves from falling sick. They give it to us for free. So I don't see how an African president can rationalize declining 300 something million dollars under the guise of wanting to protect our data. How can they care about our data when they don't care about us in general as members of their population? For example, if you go to Zimbabwe, in Harare, the capital city, they don't have consistent running water. They get running water a few hours out of the day, and sometimes they go for weeks without running water. In some suburbs, running water, they haven't had running water for 10, 15 years, and the government, they don't care. Toilets, sewage, floating. I used to live at this house in Kwazana in 2017. We had a connection to the sewer system, like it was a big round thing that led down into the sewers. It was just behind the house I was renting. And every other week it would burst, and you would see not raw sewage. When people say raw sewage, they mean the liquids. You could see raw human feces. It would stay like that for weeks. The council would come and fix, it would break down again, weeks. These are the conditions that they let us, their populations, live under. Do they care if we live or die? I don't think so. We have cholera outbreaks every now and then. Do they care? Do they improve the sanitation? No. They line their pockets, and now they are pretending like they care about us by saying, no, we will not accept this money from the US because it comes with a challenge and concerns regarding our sovereignty. It doesn't make sense. It's not about that. It's not about data. It's not about anything. It's not about health information. No. It's about accountability. They don't want someone to hold them to account to say, show us the receipts. How are you spending this money? Are you spending this money for the things that you're supposed to be spending this money for? Show us the receipts. They don't like it. They don't like it. They don't want to be exposed for their corruption. Last year, the Zimbabwean government said that they'll be providing 50 or more % of HIV life-saving medication themselves. We have to give them the benefit of the doubt and see how it works. But I can almost rest assure you that I'll be making another video telling you about how HIV positive people are not getting treatment, how it's going from controlled HIV being a chronic illness to people suffering from full-blown AIDS. That's where we are going. Just because someone is selfish. If they don't get something out of it, no one gets anything. Our governments are being selfish. I've seen that, I think it's the Zambian government and maybe other governments are also joining the bandwagon and saying, no, we don't need that money. But honestly, it's the people who suffer. It's the people who suffer. It has nothing to do with integrity. Thank you for watching the video. Like, share, subscribe for more videos, for more Zimboys. Cheers.